Good question. There are several different types of liposarcoma. And these types of liposarcoma represent a very broad range of clinical activity. You could begin at one end of the spectrum with an atypical lipomatous tumor, also called a well-differentiated liposarcoma. These are indolent tumors. They're not metastatic. They may grow in size, in fact, in maybe a millimeter or so a year. So these are very slow growing. On imaging, by CT scan or MRI, these would have the appearance of pretty similar to normal fatty tissue. When a surgeon resects a well-differentiated or atypical lipomatous tumor, they look very similar to normal fatty tissue. However, there are more aggressive types of liposarcoma. A well-differentiated liposarcoma, or an ALT, may result in evolution into a dedifferentiated liposarcoma. A dedifferentiated liposarcoma is a more aggressive tumor. These can recur locally. These even can metastasize. These are the types of sarcomas, when metastatic, that we treat with chemotherapy. Even in the advanced setting, these are sarcomas that could be treated with systemic therapy. An additional type of liposarcoma is called myxoid or round cell liposarcoma. This type of liposarcoma is different than a dedifferentiated liposarcoma. Dedifferentiated liposarcoma is driven by gene amplification of a chromosome that includes MDM2 and CDK. Myxoid round cell liposarcoma has a different type of translocation that still results in an aggressive tumor with metastatic potential. So those are the basic types of liposarcoma. The fourth type of liposarcoma would be termed a pleomorphic liposarcoma. And again, this is an aggressive, high-grade sarcoma with a high metastatic potential, similar to dedifferentiated and myxoid round cell.